Hello, my name is Ashley Hillertz. I'm a Maryville University nurse practitioner student. Today I'm going to be doing my physical exam on my patient Lainey. Before we got started, we took a full set of vitals on Lainey. Her blood pressure was 106/57. Her heart rate was 72. Her respirations are 16. Her temperature is 36.4 degrees Celsius orally, and her oxygen is 99% on room air. We also did a height and weight, and we did the Snelling test to test her far vision, and she had 20/20 vision. We had her change into a gown, empty her bladder. I washed my hands, and now we are ready for our exam. We are going to start by examining her head and face. We are going to look at the skin. We are going to look for symmetry of the skin. We are going to look at the skull and make sure there are no obvious lesions or edema. And then we are going to look at her facial muscles, and they look fine. We are going to have her do a few things. If you can just do what I do, stick out your tongue, puff your cheeks, smile, clench your teeth, squeeze your eyes shut, and wrinkle your forehead. Good. We just tested cranial nerve 6. Now we are going to palpate the skull. We are going to check for any tenderness, any abnormalities. We are going to palpate the hair make sure that it is all intact, it's not falling out, the texture, make sure it's not greasy, etc. We are going to palpate the facial bones, make sure there is no tenderness, no pain that she complains of. Next, we are going to palpate the sinuses. The only two sinuses you can palpate are the frontal and the maxillary. Any tenderness with that? Nope. Okay. Now we are going to have you test your light and pain sensations. So close your eyes and just tell me if it is dull or sharp pain.
Dull, sharp, dull, dull, sharp, sharp.
Perfect. Now we are going to move to the eyes. We are first going to inspect the eyes. We are going to inspect the eyebrows and the eyelashes. They are both uniform. We are going to make sure that the eyes are uniform on the face, as well as the ears are uniform and symmetric on the face. We are then going to look at the sclera and the conjunctiva. So if you can just look up, I'm just going to pull down your eyes. And the sclera is clear, the conjunctiva is white, there's no increased edema, drainage, etc. We are next going to palpate the limbical apparatus in the eye. Love on. That's just the corner of the eye, your tear duct. Just palpate that. Any increased tenderness there? Nope. And it doesn't appear that there's any increased drainage or anything. Next, we are going to test your near vision. So if you can just read the smallest line you can.
DFTPZELODB.
Perfect. And that is 20/20 in bilateral eyes. Next, we are going to test the pupillary response. So if you can just stare at my nose, I'm going to shine a light in your eyes. Just keep your eyes on my nose. Direct. And consensual. Very good. Direct. And consensual. Very good. Next, we're going to do the cover and uncover test. If you can just keep your eyes on my nose and cover one eye at a time. Good. And then take it off. Good. And the other eye. And take it off. Good. Now we're going to test extraocular eye movements. I'm going to move my hands out, and you just follow my hands with your eyes without moving your head. Very good. Now we are going to take the ophthalmoscope. We are going to turn it on. We always started at 0. I use my right eye to assess her right eye. We are going to look through the retina to find the red reflex. So just keep your eyes on me. I'm going to come close to you, start 30 centimeters away, and we are going to test your eye. You have your eyes here. red reflex has no opacity. If that was the case, it would be a sign of cataracts or glaucoma. And same thing with this eye. Good red reflex. Okay, next we are going to assess the ears. We first want to inspect both ears, looking at the skin, making sure that there is no breaks in the skin, no lesions, no edema, etc. Then you want to palpate bilateral auricles. They should be firm, movable, and non-tender. We're then going to complete the whisper test. So I'm going to have you plug one ear at a time, and I'm going to go behind you and whisper some numbers and just repeat them.
99.
And then plug the other ear.
88.
Perfect. Next we are going to do the Weber and the Rhine test. The Weber test, we ring the tuning fork, put it on the mastoid process, and let me know if you hear it bilaterally in each ear or more so in one ear.
Bilateral.
Good. And then the Rhine test, we do it behind both ears. I'm going to put it behind your ear, and you tell me when you stop hearing it, and then I put it in front of your ear, and you tell me when you stop hearing it again.
Okay.
Okay?
When I stop hearing it. When I start hearing it. When I stop.
Stop hearing it.
Oh, stop.
On each, behind your ear and in front of your ear.
Stop. Stop.
Good. And that's good. Your air conduction is 2 times as long as your bone conduction. And same thing on the side.
Stop. Stop.
Perfect. All right, now we are going to inspect the inside of the ear. We are going to turn it on. We look at the canal, and then we go to the tympanic membrane, and the tympanic membrane should be the pearly white. We pull the auricle up and back on an adult. We are only to stick it the speculum in about 1 to 1.5 centimeters. Looks good. Her ear canal is clean. It just has a little bit of yellow drainage, and her tympanic membrane is pearly gray. Next, we are going to assess the nose. First, we want to inspect the skin. It looks even on both sides. It's the same color as her face, etc. We are going to inspect the inside. We are going to look at the septum and make sure that there is no deviations. I'm going to use this for a light. Good. Can you plug one side of your nose? Breathe out. Can you breathe clearly through that? Okay, and test the other side. Good. So she has good patency on both sides. If you can kind of tilt your head up a little bit, I'm going to look inside your nose. We're looking at the septum. We're looking at the mucosa. She's just got a little bit of clear mucosa, and her turbulence are good. There is no gray or blue color to them. Next, we are going to go to the mouth. We are going to start at the lips. The lips are intact. There's no increased dryness, no cracking on the lips. If you can just open up and say, ah. We're going to look at the side of her mouth, the roof of her mouth. We are looking for lesions, any change in skin color, abnormality. Can you stick your tongue out so I can see the bottom? Perfect. The floor of the mouth. We are looking at the gums, making sure that there is no swelling. It looks good. No lesions on the side of the mouth, etc. Then we are going to look at the pharynx area itself. We are going to have the patient say ah again. The uvula rises and looks good. Nice pink color, no lesions on it. The tonsils look good. It looks like she has a 1+. The pillars on both sides of the tonsils are intact, pink with no lesions, white or yellow. And you can see the posterior pharynx, which is pink with no lesions. Then we are going to assess the teeth. Smile, good. And she has the correct number of teeth, bite down, and they all fit in line with each other. The color is white, and it looks like she has no cavities. Then we are going to assess the tongue. It's easiest to assess the tongue using a gauze. So if you can stick your tongue out, move it from side to side, up and down, good. And I'm just going to grab it, pull it out, look at the sides for any lesions or abnormalities, and it looks great. Good. Now we are going to move on to the assessment of the neck. We assess the neck first by looking at the skin. Good, it looks like it's intact. There's no abnormalities, there's no goiter that is seen. Next, we are going to want to assess for any jugular venous distension. So she needs to be laying at a 45-degree angle. I have the bed at a 45-degree angle already. Okay. And we look for any jugular venous distension. And it doesn't appear that she has any pulsations. If she did, that would be an indication of right-sided heart failure. Okay, if you want to sit back up, then we're going to have you just shrug your shoulders up and down. Good. And we're going to do a little range of motion. I'm going to have you flex your head forward, extend your head backwards, go from side to side, and then rotate your neck. Any pain or tenderness with that? Okay. Now I'm just going to push against you a little bit, and you do the same movement. So forward, back, side, side. Good. Okay. Now we are going to palpate the neck area. First we palpate bilateral carotid arteries, and you always only want to do one at a time. These are nice and strong. Then we want to palpate the trachea. It should be midline. Good. And then we are going to palpate the thyroid. So in order to palpate the thyroid, we push it over to the side, and then I have you swallow. Would you prefer to swallow with water or just swallow on your own? Okay. So we're first going to push it over. Go ahead and swallow. Good. I can feel a firm nodule. It feels like it's about 4 centimeters, and there is no tenderness, or it doesn't feel like there's any masses. And swallow. Perfect. Okay. Now we are going to assess the lymph nodes of the head and neck. We start with the occipital. We do this bilaterally. We're testing for any tenderness, if they are palpable, pain that it causes her, etc. If they're stable or movable. So occipital, post-auricular, pre-auricular, tonsillar, submandibular, submental, anterior cervical, superficial, posterior cervical, and supraclavicular. And it doesn't feel like any of hers are palpable, so that is a good sign. Now we are going to listen to her carotid artery and her thyroid using the bell of the stethoscope, and we are testing for any bruits. Hold your breath. And exhale. And hold your breath. And exhale. Good. No growths heard on the carotid. Or the thyroid. Very good. Next, we are going to assess the posterior back. We are going to, if you can kind of turn that way for me. Thank you. Okay. We are going to assess the thoracic configuration. We are going to look at the skin. We can palpate, it feels good. And then we are going to palpate and percuss the costovertebral area. And if she has any tenderness in this area, that could be a sign of right kidney failure, and it doesn't appear that she does. So very good. Next we are going to move on to the lung assessment. First, we want to start by assessing the respirations. The respirations are usually assessed throughout the exam because you don't want them to necessarily know they're counting the respirations. So you inspect counting the respirations. Then we are going to palpate, and we're first going to palpate the expansions of her breath. So I'm going to put my hands on the back of your chest, and if you can just take a deep breath. And then, good. And one more. Good. And her chest walls went out bilaterally. Next, we are going to palpate tactile fremitus. So I'm going to put my hands starting at the top of your back, and if you can just say 99.
99.
Again.
99.
Again.
99. 99.
Perfect. If there was increase or decrease tactile fremitus, we would be concerned for consolidation or increased air in the lungs. Next, we are going to percuss. We can percuss the posterior back first. You want to make sure you do this in a symmetric form so that you are testing the sides equally. You should be hearing resonance over the lungs. And once you get down to the other organs, it should be dull. Resonance is over the entire lung. Then we are going to do it laterally, so if you can just put your arm up in air. Perfect. And percuss. And once again, it should be resonant. We're going to do it on this side. Thank you. Very good. Then we are going to do diaphragm expansion. So I am going to be percussing down your back. I'm going to ask you to hold your breath. I'm going to start up at the top, hold your breath, and I'm going to palpate down, percuss down, until I hear dullness, and that's the top of your diaphragm, and then I will ask you to breathe normally. Okay? So take a big deep breath in and hold it. Good, and exhale. And then I'm going to have you take a few deep breaths, and then when you're ready, exhale and hold it. Good, and you can breathe normally. And then we're going to measure that. Like it is about 6 centimeters, your diaphragm, and that's perfect. Next, we are going to auscultate the lungs. We can start with the posterior, since we're in that area. You want to auscultate all areas with the diaphragm of your stethoscope, and you should be hearing good vestibular breath sounds. Over all the lung fields. Okay. You are also going to do the lateral portion. If you can just raise this arm up. Deep breath. Deep breath. One more. Good. This side. Good. I have not heard any adventitious noises like wheezing, rhonchi, etc. Yeah. Then you want to do the anterior chest. Excellent. So that's the assessment of the lungs. Next, we are going to go to the anterior chest and assess the heart. First, you want to inspect the skin around the chest, You want to check for any visual thrills or heaves around the chest area, chest cavity. It looks good, the skin is all normal skin color, etc. Then you are going to start palpating, and I will have you lay down. We're first going to palpate around the heart. You are going to palpate the apex all the way down to the base. Good. And then you are going to check for the apical impulse, which is the left fifth intercostal space, typically on most people. And I do feel that. Good. Next, we are going to percuss. You can percuss the chest wall bilaterally. Good. We already did tactile phragmatus with the lung examination. We are going to, if I can just pull this arm out, we are going to test your axillary, lymph nodes, and your infra. Good. Your infraclavicular and your axillary lymph nodes. And it doesn't feel like they're palpable and no tenderness? Okay, very good. Now we are going to do listen to the heart. You want to assess all of the heart tones. So you start at the right second intercostal space, aortic, pulmonic, herbs, tricuspid, and mitral finally at the fifth intercostal space. Sounds good. I heard a clear S1 and S2 with no murmurs, and I did not hear S3 or S4. Next, we are going to start the assessment of the abdomen. First, Lainey is wearing shorts, so I'm just going to pull up her gown here. We are going to assess the abdomen, the contour of the abdomen. It looks even. There's no obvious heaves anywhere. It looks like she has equal respirations, etc. Next, you always want to auscultate the abdomen first before doing any palpations or percussions. You want to auscultate in all four bowel areas. And her bowel sounds are present in all four areas. Then we're actually going to auscultate the arteries. You start with the aortic, which is to the left, 2 to 3 centimeters. You are checking for bruits, hearing. Then you go to the renal, which is on both sides. No bruits. The iliac, and the femoral. And no bruits. Good. Next, we are going to percuss the abdomen. We can do a just general percussion over everything. There should be no tenderness or pain caused by the patient when you do overall percussions, and then it should be dull over any organs. We are then going to percuss the liver. The liver is on your right side. So we start here. Once we feel dull, it's usually between the 10th or 11th and 12th rib space, which it is, and then we can percuss up, and there's dullness again. So that is typically 6 centimeters, and it appears that hers is, we can measure. Like hers is 6.5, 7. Very good. Then we are going to percuss the spleen, which is on the left side. And the spleen is typically between the 6th and 8th intercostal spaces. And that should be dull, which we hear. Next, we are going to palpate. We are going to start by doing light palpations over the entire stomach. Once again, we are testing for any tenderness or pain that it may cause. Feels good. Then we are going to palpate the liver. So the way you palpate the liver is you put your left hand underneath. I'm going to have Lainey take a deep breath and exhale, and I'm going to kind of push under your ribs, and we'll see if we can feel it, okay? So big deep breath, exhale, good, sorry, nope, I don't feel it, and that is a good sign. We are also going to palpate for the spleen, and I don't feel that. Next, we palpate the kidneys on both faces. The kidneys are down lower, they're usually in between the 12th rib, and you squeeze together. Sometimes the right kidney, the tip of it is palpable, and I do feel the tip, and it's firm, and it appears to be non-tender. And then you can do the same thing on the left, and typically the left kidney is not palpable. Good. The last thing you want to palpate on the abdomen is the aortic dissension. It's to the left of her umbilicus. And you just want to feel that pulsation. And usually it is about 2.5 to 4 centimeters. And I do feel it. Very good. Now we're going to look at the extremities. First, I'm going to look at her arms. We are going to look at her hands. We are going to look at her nails. We can test cap refill. It looks like it's less than 2 seconds. We can check for clubbing, skin integrity, etc. We can palpate the fingers, feel the joints, make sure there's no tenderness. She can move her wrists all around, her elbow, and her shoulder. Okay, and we'll just do that on the other side as well. Cap refill is 2. Wrist can move, no tenderness. Move your elbow and move your shoulder. Good. We're going to test the radial and brachial pulses. And those are both 2+, which is a normal finding. We are then going to go to her legs. We can assess the legs for color, the skin looks good, hair distribution, her feet. Let's take off one part. We are going to look at her feet for any edema. We are going to palpate for temperature, any tenderness over the joints. It feels good. We are going to assess her dorsalis pedis pulse, her posterior tibial, and her popliteal, or behind her knee. Perfect. And we would do the same thing on the other side. Good. And it feels like her posterior tibial is a 1+, and that is okay. That's a normal finding. The other two are 2+. Okay. Now we are going to do the neuro exam. We've actually covered many of the cranial nerves, but we'll run through them to make sure we got them all. Number 1 is the olfactory. We usually don't test that. That's smell unless they have some kind of suspected head trauma or Addison's disease. Number 2 is optic, and we tested that with the near and far vision, and she had 20/20. 3, 4, and 6 are all testing her eyes as well, and we did that with the extraocular eye movements. I also looked at her eyes with the light, and pupils were equal and reactive to the light. Number 5 is the trigeminal, and that was done with sensation to the face. She told me the difference between dull and sharp when I used the tongue depressor. And she also had, we can test the temporomandibular joint. So I'm just going to palpate the temporomandibular joint, and I want you to open and close your mouth. there's no cracking or popping. That's another good one to test for the trigeminal. And then number 7 we'll go to now is the facial nerve, and we tested that by having her smile, close her mouth, etc. That one can also be used to test the taste buds. Number 8 is acoustic. We use the tuning fork to test Weber and Rhine. Number 9 and 10 are the vagus, and we tested the ah reflex, and we will just do a quick gag. Good. And then we did 11. We did that with the shoulder shrug and the range of motions with and without resistance. And then finally number 12 is the hypoglossal, and we tested that with the tongue moving it up and down and around outside of her mouth. Next we can test sensations on other parts of her body. We are going to do the same thing we did on your face, so you just tell me if it's sharp or dull. Okay. And we are going to first test that on your hand, if you can close your eyes.
Dull. 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 Sharp.
Okay. We'll do this one.
Sharp. Sharp.
Good. And we'll do your feet.
Dull. Sharp. Sharp. Dull.
Very good. Okay, and so that's sensation testing for, once again, dull and sharp pain. We can also test her sensations. If you can close your eyes, Lainey. I'm going to bring over an object. I'm going to set it in your hand if you can close it. And if you can tell me what that object is.
A coin.
Good. And let's see your other hand. I'm going to put a different object in that.
Key.
Very good. So that's another sensation we can test. And next I'm going to draw a number in your hand. Okay. And if you can tell me what number I'm drawing.
8.
Good.
0.
Perfect. So that is the neurological exam. Next, we will move to the musculoskeletal exam. We are first going to assess some of her reflexes. So I brought a reflex hammer here. We are going to do the brachial reflex. Good. Good. She has a brisk. And then I'm going to have you actually sit on the side of the bed here. We're going to do the popular knee reflex. Good. Good. And then we're actually going to do the Achilles reflex as well. Okay. You probably can't see that. And we did the Achilles reflex on her ankles. All of her reflexes were brisk and appropriate, not hyperactive or anything. I'm actually going to have you stand up now and just do a squat down for me. We're testing your musculoskeletal. Very good. And you can take a seat. Okay. We're going to test some muscle strength now. So if you can put your arms in front of me, I'm going to push resistance against you and you fight against me, and then push on me. Good. Can you move your wrist, elbows? Good. Next we are going to assess the cervical spine. First you want to look at the back of her neck. You want to look at her skin around her cervical spine. If there are any skin depressions, you want them to be bilateral, and it doesn't look like she has any. There's no obvious lesions, no protrusions, and it looks good. So then we are going to have her do the cervical range of motion. First, we kind of already did this, but we'll do it again. If you can flex your head forward, good, 45 degrees, that is about right, and hyperextend, 55 degrees, good. And if you can go lateral, 30 to 40, good. And then rotate your head as best you can. Good. And then we're going to do that against resistance again. Push forward, push backwards, push to the side, and you can rotate. Perfect. Okay. And next we are going to test your thoracic spine. So first I want to inspect the skin around your thoracic spine. It looks good. Thoracic spines are normally concave on the patient, and it does look like she is concave. We can palpate like I'm doing to test for any tenderness, any bulges, etc. Doesn't appear that she has any. And then we can percuss the spinal process. Good. And then we are going to do range of motion on the thoracic spine as well. So I'll have you stand up again, and if you can lean forward, good, about 75 degrees I'd say, and then I'll lean back 20 to 30, perfect. And then if you can lean to the side, 30 to 40, lean to the side, and can you rotate at your trunk? Excellent, okay. And that completes that. And you can sit down. And that completes our physical assessment today. It appears that Lainey is healthy and doing well. Thank you.